body's very own detox factory, a complex and fragile piece of organic machinery, all prepped and ready to take the slow poisons of everyday life and make sure they don't send the entire system into an early grave. But under that huge burden, even the strongest of livers can crumble when the wrong disease comes a-knocking. And sometimes the solution isn't as simple as drinking less on a Saturday night. Jaundice, liver cancer and all the hepatitis from A to Z, they are the barbarians at the gate. But no worries, right? Modern medicine's got a few tricks up their sleeve. And healthy living, well, that's been around since maybe forever times. Now it's time to take a closer look at it. Let's start by asking the doc, what are the various types of liver problems that can develop? Doc?
Liver problems can actually be divided into two kind of problems. One is acute kind of problems and one are acute chronic kind of problems. Acute are those short-acting problems which can happen in a patient. And the commonest ones which we are aware of is jaundice, in which you have yellowness of the eyes. Now, jaundice can be because of either hepatitis or it can be because of some sort of inflammation in the liver because of other reasons. For example, alcohol related or toxin related. It can be a side effect of certain medicines also which we take. Apart from that, liver can be stunted because of many other conditions. Even a general infection in the body can go and affect the liver. Typhoid fever, amoebiasis, amoebic infections or any other parasitic infections can also go on to affect the liver. You can have cancer of the liver also. There can be trauma in the liver, which can any injury, any abdominal injury because of road accident. The doctors are very particular about seeing whether liver is affected in some way because it can bleed very heavily. Now, liver are known to produce clotting factors in our body also. So, any kind of clotting problem which we have in the body can be related to liver. Apart from that, probably you can have certain kind of abscesses, which means a pus collecting sac, which can be there because of bacterial infections and others. I think for all practical purposes, these are the general kind of problems which we see day to day in a patient who comes to us with liver problems.
Sure, I'm not the only one who just thought that. Oh! Sorry about that. Now, who are in particular are vulnerable to liver disease? Just a little less graphic on that one, Doc.
I think a person who takes care of his liver takes care of his life quite well, because liver is one of those organs which has multiple functions. Who is vulnerable to a liver problem? Of course, patient who abuses his body. So I think any person who drinks alcohol on a regular basis without any control, patient who probably uses toxins in a different way, patients who have taken medicines without consulting the doctor. Indiscriminate usage of medicines can cause a lot of liver damage. In fact, most of the medicines we take either get excreted through the kidneys or through the liver. So obviously, if liver is one of the major sources of excretion of the body or metabolism of the drugs, if it is not well treated, it can cause problems. And one of the very common causes which we see over recent years is hepatitis. Now, hepatitis can be of many types actually, but the two common ones are the ones which are related to bad food and water which we eat, and second is which we get because of needle stick injuries, which are not well sterilized needles or disposable needles, or in small places where probably people just reuse the needles again and again. Common causes of hepatitis.
All right, on that note, let's meet today's guest, a hepatitis patient. Let's ask him how and when did he find out that he had hepatitis?
Well, I had some stomach problem and I consulted my doctor. There was some vomiting that had occurred and he asked me to undertake certain tests. Given my history after those tests, it was confirmed that I had grade 3 varices, something which I knew nothing about. And I was diagnosed with alcoholic hepatitis. So the doctor gave me certain basic medicines and he made it sound quite simple. I went ahead with my medication. As advised, I stayed off alcohol and spicy food, and I was fine for almost 7 to 8 months after that. But in 2004, I had a bad case of food poisoning which led to internal bleeding, and I went into a coma after this bleeding problem. And that's when I realized that this was a serious disease which needs to be taken care of, and I shouldn't take it lightly. So I stuck to the medication as advised by the doctor and followed up on the dietary regulations that he'd asked me to undertake.